Hi guys, welcome back to my channel. If this is your first time on my platform, thanks for stopping by, and if you're a returning subscriber, thank you very much. Okay, so today I have with me my sister. She's a guest on my channel today, and she's going to be asking me questions about sickle cell disease. Actually, I've not seen the questions. I don't even know what is coming up. I'm surprised and just as you, but I'm going to be clarifying some questions. I hope that my belief is that the questions or the worries she has is the worries you also have. So I'm not a doctor. I don't know anything about medicine. So this question I'm going to ask is to help us, people like us that have zero knowledge on sickle cell disease. Okay, let's get sickle cell disease. What is sickle cell disease? Okay, to put it in the simplest way I know, sickle cell disease is an autosomal recessive disease, meaning that it is an inherited disease. It is where a nucleic acid called valine replaces glutamic acid and thereby disrupting the whole shape of the red blood cell, causing the sickle cell crisis. Okay, and in simple terms, because we have no school boys. Okay. Yeah, in simple terms, it just means the patient has a problem with the red blood cell. It is hard. It is not as flexible as a normal patient own. That is it. How is the disease diagnosed? Hey! Okay. How is sickle cell disease diagnosed? Sickle cell disease is diagnosed with a test known as HB electrophoresis. HB means hemoglobin electrophoresis. So you go to the lab, the doctor is going to prescribe you to do an HB electrophoresis, and this will tell you if you're AA, SS, or AA or AS. SS means you have two genotypes, like you have two SS genes. You have the complete sickle cell gene. AS means you're a carrier. So SS, you're a sickler. AS, you're a carrier, and AA, you're normal. And when you do this test in the lab, the A and the S have various percentages. So depending on the percentage of each will determine if you're a carrier or not. For example, a patient can be a carrier and the A gene there will be 95% and the S genotype will be 5%. So the patient is apparently a carrier. So that's why it's diagnosed with HB electrophoresis. Okay, thank you. I understand, so I have no extra questions. So, what are the signs and symptoms of sickle cell disease? Okay, firstly I'll start with the signs. Signs means what you can see on what the doctor sees in the patient. So some signs of sickle cell disease: first, busting of the frontal bone, like you see as people calling up, this frontage like this, the frontal bone is really going to be very prominent. You see the patient has swollen wrist. The wrist is going to be swollen. Apart from that, the patient also have prominent incisors. These here will also be very prominent. You really see them big. Other bones in the leg, like the ankle bones, will also be very prominent. And then for some symptoms also, you will notice that the patient constantly complains of joint pain. Always complain. The patients are always in pain. Then another symptom is chest pain. They always have chest pain. So those are two important symptoms: chest pain, bone pain. They're always in pain. How does this pain happen? How? Okay, as I've said previously in the definition of sickle cell disease, this mistake in quotes causes the red blood cell to be rigid. So when the red blood cell becomes rigid, blood does not go to the further areas of the body. For example, if blood is flowing through any of my arteries or my veins, when it reaches a capillary, a small capillary, if the normal red blood cell is able to fold and bend itself because it is elastic, but the rigid sickle cell, a sickle shaped red blood cell, is not going to be able to fold. So what happens is that it occludes that capillary or occludes that artery. And when you occlude that artery, what happens is like this other side of the body is not able to get oxygen. So when the other side is not able to get oxygen or blood, that area just gets into pain. So it's because of the occlusion, the hardness of the red blood cell. So blood is able to get to that area. For example, it can happen in the heart, it can happen in the brain, it can happen in the bones. So that's why they have their pain, because blood is not going to that area, because a rigid sickle cell red blood cell has blocked the artery. And that's why you also notice that patients who are sicklers are also prone to myocardial infarction. Myocardial infarction is known as heart attack, and also prone to stroke, because you can occlude an artery leading a coronary artery, that's an artery of the heart. And when you occlude this artery, what happens is that there's no oxygen, blood does not get to the heart, and the heart is going to die. That area of the heart is going to become ischemic and leading to heart attack. Same to the brain. When you occlude an artery leading to the brain, that artery is going to be blocked, no oxygen, ischemia. Ischemia is decreased amount of blood supplied to an area. And when it happens, that part of the brain is going to die and stroke. Yeah.
There was a lot of big grammar inside of it. I understood to all that. Anyway, what medical problems can be caused by sickle cell disease?
It can cause organ failure and organ enlargement. For example, most sickle cell patients have what they call splenomegaly and hepatomegaly, where you have enlargement of their liver. The liver is an organ in the upper right quadrant of the body, and the spleen also. So you will notice that most sickle cell patients, their livers and their spleen are enlarged. They also have heart failure, because to compensate for the fact they don't have enough red blood cells. So the heart has to pump a lot and at a greater force to be able to compensate that vaso-occlusive crisis. And you also notice they can also have kidney failure. Yeah, so kidney failure, heart failure, organ enlargement, and organ damage.
How long does a person with sickle cell disease live?
Okay, for that, people have their own studies, people have their own knowledges about this. And from the sources I've gotten, sickle cell patients can live as long as possible, but the determining age is 25 years. It is believed that, or it's scientifically shown that, after 25 years, a sickle cell patient can now live he or she's normal life and get to old age. Before 25 years, it is indeterminate. They can die at any time because of the vaso-occlusive crisis. Imagine not having enough oxygen supply to their heart. The patient can just die instantly to the brain. So these are many as I said, maybe complications of sickle cell disease. The determining age is not really definite, but 25 is a limit.
So what can you say to all these these people out there? What can you advise them?
The first advice is they should watch this video and share this video definitely, so to educate other people. Secondly, everything is not about loving. Before getting married, you should meet a well-trained doctor. He or she is going to prescribe some tests, and those tests, part of them, as I asked previously, how can it diagnose sickle cell disease? They're going to prescribe HB electrophoresis. HB electrophoresis are going to tell you if you're a sickler or not. So always do it. And if your doctor tells you that you're a sickler or you're a carrier, mama, two of you, if you're carriers, you cannot get married. If you're sicklers, you cannot get married. So firstly, do your HB electrophoresis before thinking of bearing children, because I see patients in the hospital, actually they are suffering. Some of them are like, mama, why did you give birth to me? Mama, why did you born me? And a lot of time it gets tiring. So first thing first, do your HB electrophoresis. Ensure that you are not a sickler. Ensure that your partner is not a carrier, because the best combination is a normal person and a carrier, or a sickler and a normal person. Yes. So do your HB electrophoresis and ensure that you are not sickle cell. You and your partner.
What are the treatments for sickle cell disease?
Sickle cell disease actually cannot be treated, but there is theory that this and this can be done, and some of these theories have been practiced in the Western world. Firstly, you have bone marrow transplantation, because you know that red blood cell production and replication occurs in the bone marrow. So now there's a surgery which actually you can take the bone marrow of a healthy patient who is AA, and give a sickle cell patient, which is going to help in the production of normal red blood cells. So that's one tactic, but as I said, it's not theoretical. It's not really in practice, because because removing a bone marrow of somebody is not really feasible. And the second treatment modality, we have exchange blood transfusion. It is not really a treatment modality because you still have your bone marrow is still producing the red blood cells, but it will just reduce the crisis at the moment. So what happens in this is they remove all the blood from the patient. As immediately as they remove the blood from the patient, they're transfusing new blood to that patient. Yes. So exchange transfusion and bone marrow transplantation is a treatment modality. It's very affordable. This treatment, that's why I said it's not too feasible because it's very expensive to do a bone marrow transplant. Apart from that, it's expensive. It's very, very risky. So the other ways that we help these patients, especially those who cannot really afford, there are some treatments, there are some drugs or medications that are constantly on. Firstly, you have hydroxyurea. Secondly, you have folic acid, and thirdly, you have iron. I'm just going to give the advantages of all these three. Hydroxyurea helps in the maintenance and the production of hemoglobin F, which is fetal hemoglobin. Fetal hemoglobin has a higher capacity of oxygen. So they always tell the sickle cell patients, if you notice, they always take hydroxyurea. It helps to reduce their crisis and their pain. The second is folic acid and iron. Folic acid and iron helps in reducing megaloblastic anemia. Yes, it helps in still reducing anemia. That's reduced amount of red blood cells. So this is a goal for those who cannot really afford that treatment modalities, hydroxyurea, iron and folic acid. They're always on it, and that's how this helps them. Firstly, sick class is not your fault. It's never your fault. Don't blame yourself. It is not your fault. And secondly, I'll just advise you to just keep going, because I'm noticing that most sick class they don't want to take their medications. It's not your fault, so you just have to take it. Please, the 3 medications are listed for those who cannot really afford the surgery. Just take the treatment. It's going to help you, and just push yourself to reach 25. By the time you reach 25, things will get better. I want you to just hold on to yourself and say it's not your fault. And in any way you can now, you will use your situation to give God the glory. So just keep pushing, go for your routine consultations, and keep taking your drugs and be hydrated. Be hydrated. Always drink a lot of water to make your blood less viscous, like to make your blood less thick.
Yeah, Harris, thank you very much. That's really helpful for our video. I understood a lot, and I hope you guys have also understood.
Okay, thank you for the questions. Honestly, I really hope you guys understood. I really pray I was not too doctor and so scientific. If you didn't understand anything, the pathophysiology or any question, you can ask me. I'm going to explain. And as she said, and as my sister said, there's definitely going to be a part 2 coming up. You can drop the topic on us to discuss about, because my sister is learning journalism skills, so just give it to her. Yeah, so please keep drop your comments, tell me what you want to learn about, and I'm going to give it to you full time. Hey, have you subscribed? You want to go? Have you subscribed?
Yes, so click that red button, subscribe.
Subscribe,
for 1 year. Good luck.
Yes, so for 1 year, good luck. I beg, subscribe, share, I beg.
We need your subscription.
Please.